My name is Gorana Kuka-Epstein, and today I have a pleasure of hosting one of my favorite hair doctors and my friend, Dr. Jean Devroye from Belgium. A little bit about him. He's a doctor of medicine, surgery, and obstetrics. He specializes only in hair since 2000. And his first training he completed in the US. He uses both techniques, FUT and FUE. But what is most important about him is what he delivered as his invention to our field of hair restoration. In my personal case, I have a doctor who taught me how to do hair transplantation, but this doctor helped me improve it because he gave me the best tool to harvest grafts. And we're going to talk about that today. Welcome, Jean.
Thank you, Gorana.
Welcome to Miami. Welcome to our podcast.
Wonderful.
So we're going to talk about best tools to reach the low FUE rate of transaction. And I would like to hear from you. We all know that we started doing FUE with manual punches. Did you ever use manual?
Yeah. I was trained first by John Cole and by one of his assistant, Dr. Mwamba, who came back to Belgium with the FUE technique. And he, in the beginning, he was working with me. And so I learned with him how to use the manual handle. And I believe it's a very good way to be trained, even now. Because when you do that, you feel the movement, you understand what you are looking for. The only problem is that you cannot use another punch than the sharp punch.
Right.
And to avoid transaction with manual technique, it's really difficult. Some experts are able to do that, but many times when people use manual, the result in terms of quality of the graft is not really good. Sometimes it could be, but many times when the case is difficult, manual is not the best way.
So when did you transition to automatic?
It took a while, because after I began to do the FUE, in fact, I left the FUE. And the reason was because I was, and I'm still, an FUT doctor, and I was so disappointed by the quality of the graft that after a few months, I remember sometimes my assistant was telling me, "Oh, today it's really not good in terms of transaction, you know." And I was really sometimes desperate. I was trying to improve, and I didn't find the good way. And I was considering that it was not honest to continue to do the FUE. And I went back to the FUT. And I remember in the forums they were telling me, the FUT man, you know. It was like I was the specialist in FUT.
And FUE was already there.
Yeah.
Doctors
FUE was
started
there.
to do FUE already.
Sure. It was a beginning. It was 15 years ago, but I don't remember exactly the details. But probably for 1 or 2 years, I left the FUE on the side and I continued to do FUT. But I saw that the demand was growing.
Yes.
And I decided to
give it another chance.
Yes. Yeah. But my idea, and from the beginning, my idea was I need to find the way to improve this technique, especially in terms of quality. It was something that was really my main concern.
So to pause your talk there, I started my hair practice doing automatic with the automatic device. So I never tried actual manual punch other than for punch biopsy. And I was happy with the transaction, but still I thought it was high. And I was improving. And then I realized something was missing until 2017 when someone told me try the WA. And I was like, I don't know how much WA can improve the work of my hand. And the WA is actually a device that you wind up inventing. So could you tell me how and why did you start thinking about the WA?
Yes, the first I had the idea from the beginning to find the solution, but it's not easy because the main problem in hair transplant is the fact that the shape of the hair is like pyramidal very frequently. And we need to this is what I call the equation with many unknown solution, and that doesn't have a very good global solution. Why? Because we would like to have in the same time to reach this pyramid, this follicular unit. And to be able to remove it easily. But to do that, we need to go deep enough. And in the same time, we would like not to use a punch that is too big, because if you increase the size of the punch, you will make a big hole. This is not a solution.
Yes.
So trying to reach a good graft with no transection, with a sharp punch, is something that is really difficult to do, because we have two choices: or we go deep but we will transect, or we increase the size of the punch, but it's not what we would like to have. And the first time I saw the solution was probably in Istanbul. We had a meeting there. Organized by, I think, the European Society with Korea Erdogan, and I saw Jim Harris. And for me, the solution of Jim Harris was not good, because I had the idea of this three-step technique with the blunt punch, and I knew that by pushing, he was making a lot of buried. But I saw him walking, and this is why it's always good to go and to visit people, and even if you have an idea in your head, to observe, open your eyes. And I saw Jim doing the extraction, and the result was really nice, really good. So I took a look, and I saw that the punch had a flat part. But Jim made something that is the contrary of what I made. The punch is going that way with a little flat part here. And immediately I realized that in fact what was the cutting edge was that angle here. And I went back home, and I already had a little lace for watchmaker that I bought on eBay. And I took the old punch from John Cole and I chopped the tip, just that. And I obtained like a tube like this, but with a flat part.
Right.
And I tried it, and I saw that miracle. It was working. It works. You can try. You just do that. You take a tube, and the angle, which is a 90-degree angle, will cut perfectly. But it's still not perfect. And after that, I work a lot on it, trying different solutions. And after many trying, came to the solution that I use now. Now I have what I call a tornado. Tornado is like a T. And so the cutting edge is completely external. I still have a flat part, and I have in the middle a funnel. And with this configuration, I can really have a huge improvement in terms of transection. It's possible to do almost everything I was looking for. Going deep with not a lot of injury, still having a diameter of the punch small. I use mainly 0.9 millimeter in terms of diameter, external diameter. Sometimes 0.95. It's also good to sometimes increase a little bit to have a chubby graft, or sometimes to have small graft, 85 or even 8 to obtain, for example, one hair graft. And this is the story of my invention. But it was it was first the punch, and after that I came to the idea of reproducing the movement that we have with the manual. This is not really original. John Cole already made it. What we call the oscillation, but the oscillation, especially with the wow punch, is essential. And why? And this is very interesting to analyze everything and to really try to understand what happens. I made many essays on strip, and this is funny because you when you still do FUT, you have strip every day, and this is where I was training myself, and I was looking also by the side what I was doing with my punch. So it was very interesting. It was like I had a camera to see under the skin. And what I saw is that, and I didn't realize that in the beginning, that in the beginning when you turn, you cut the skin and the hair are still stable.
Okay.
But when you go inside, especially if you go deep, and especially with my punch, because my punch has a lumen that is smaller than with a sharp. Because I have this teeth, so by definition, the lumen is small. And the graft, it's like a miracle because the graft could go for a punch of 0.9 external, it's going in a 0.6 inside.
Yes.
So it goes. And when it's going inside, at a certain moment, the graft is really stuck inside. So when the punch is turning, in fact, the graft is turning also. It's like in a washing machine.
Right.
It's really like that. So if you spin, if you have a rotation with the wow, the danger is to torch the graft. So this is why I believe the oscillation is really essential
to release basically the graft.
Not to release, so the graft with this movement of oscillation.
Right.
But just living finally at the same place, not a complete torsion.
Right.
And this is what I do now. Now I continue to use oscillation, and I try to have the smaller angle in terms of oscillation for that reason, to try to injury as few as possible the graft. This is my philosophy. I try to just to do as few movement as possible to obtain my follicular unit.
Yes, the people don't know how important that part of harvesting is, because the more damage is done there, those grafts are not going to grow. And the second important thing is what kind of grafts we are getting, how big they are, how whole they are, do they contain other elements of that follicular unit, and lastly, how the donor area looks like after that harvesting. So just to clarify to the listeners, transaction rate is basically if we do 10 extractions to see how many grafts we're going to get out of there. And the goal of us hair surgeon is to have the lowest transaction as possible. And then there is partial transaction when you, instead of taking the 3-hair graft, how it naturally grows, you cut one of the hairs and out of there it comes 2-hair graft. That's partial transaction. And it is my experience with the WA device that my transaction rate went down, but also that partial transaction went down as well, because I'm transecting less. I'm getting the graft out as a whole. That's my surgical experience.
Yes. I should say I became a specialist of quality control because now it's a little bit less, but for years I was my team was controlling everything every day, every time. All the graph was counted. So it's easy. We are just counting the number of transections, but not only the number of transections, the number of hair that we have in each graft.
Right.
Because this is something I believe important. We are talking about the rate of transection. What I like to do is to compare the number of hair per graft that I should have let's imagine I don't have any transaction. And I'm trying to get, 2.5 hair per graft. So if I get 100 grafts, I should have 250 hairs. Mm-hmm. And I will take a look at the number of hair I have at the end and divide it by the number of grafts that I obtain. And I will have these two numbers, the rate of hair per graft that I should have with mm-hmm. no transaction, with the real number of hair per graft that I get. And in fact, the difference is the rate of transaction.
Yes.
So this is really interesting to speak about these two numbers and not only about the rate, because I will just give you an example. It's if you try to get essentially 2 hair graft with a punch that is 1 millimeter in terms of diameter, you can have a low rate of transaction. I would say it's easy to have a low rate of transaction, but it's much more difficult to have the same low rate of transaction if you are trying to get 2.5 hair per graft or 2.4 hair per graft with a 0.9. And this is important to know everything, to know the diameter of the punch that you use, and to know these two numbers, not only the rate of transaction, but these two numbers. And it's really easy to do. I have a little Excel program that I propose for free, and it's really easy to count. It takes just time. So you have to invest in your assistant, but it's really nice because you realize what you do. And what I do now, because I don't continue to do it for all the graft. But what I do systematically, it's at the beginning of the surgery, I do my first 100 grafts and I ask my team to count it under microscope and to give me this number. And I can adjust essentially the size of the punch or the depth also to improve.
Right.
And the second...
That's like test. Let's test first.
And the second number, very important, that very few people are looking for, is what we call the missing graft. The missing graft was, I would say, invented by a little group, John Cole, Bob True, Jose Lorenzo, and me, to essentially because we wanted to qualify what the robot was doing. We saw that the robot was we had a big difference between the number of attempts and the number of grafts that were available. And this is something that really we have to count, because when you use a sharp punch, you have many times complete transected graft. You have many capping. Capping is because you are not going deep enough and you try to remove the graft and you just have the piece of skin and you leave the graft inside. Many people say, oh, it doesn't matter because finally they will grow back. Yeah, okay, they will grow back, but your goal is not to have hair here growing back. Your goal is to have hair taking from here and growing back here. And this number of missing graft is really important. And with my system, not only we decrease the rate of transaction, we increase the number of hair per graft, and we decrease the number of missing graft. And all together, it's almost always automatic when I compare a sharp punch, same diameter with the wow on the same person, same area, like here on the right and the other side on the left. Exactly the same thing, except the punch is the technique. No, even not the technique, except the punch. It's really frequent to have like 10% more hair automatically. So it's nice.
Yes.
10% is important.
It's a lot.
And sometimes more.
And what is important for prospective patients to know, when you take 3,000 grafts from the back, that could be 3,000 hairs, or could be 7,000 or 8,000 hairs, depending on that ratio hair per graft. Yeah. And that, as a patient, you should ask your surgeon, doctor, how many hairs per graft are you getting on average? How many 1s, 2s, 3s, and 4s? That's going to tell you what how good your surgeon is and how many whole grafts he can take. And if he's only getting one, unless you're a very specific patient that's how your hair grows, that means that your surgeon is making a lot of transection. It's hard to make a good coverage if you only have single hair grafts, almost yes. Impossible.
I remember that some doctor claimed that they were just doing one hair graft. Like, okay, it's really, really refined because they are doing one hair graft. But if you think about it, it's not really a good idea.
No.
It's an obligation to have enough one hair graft for the beginning, for the hairline. But after that, it's much better to continue with 2, but not too much, and with 3 or 4.
Right.
And this is a big advantage of the FUE comparing with the FUT, is that you can choose the big apple.
Yes.
So the goal is to get the best one. There is many debate about it because some doctors say, okay, yeah, when you do that, you will decrease the density here, and it's true. But again, the goal is to have a good density here.
Yes.
And if you take less the first time, to get the same result, you will have to come a second time.
Right.
So if you can do the same in one step, I believe it's better. For the patient, it's better. If you have a doctor that is aware of the limit and that they pay attention to the result in the donor area, because it's true, when you take more hair, the risk to have a depletion is more important. You have to stop earlier.
I was paying a lot of attention how the donor area is going to look, and I was using smaller puncturiors, and then I realized it doesn't matter that much because really donor area heals so well with the WA system. So I would say a good surgeon has to have a technique, device, and a team. And I've been using your device for now 4 years already, and I thought it couldn't get any better. But you surprised me again with the new device that you came up with. So it's different than the first generation of WA.
In fact, many people told me that it would be good to have a multi-phase system. I believe it was invented by Dr. Trivellini. I don't believe John Cole had this system, but Dr. Trivellini is doing that. He's doing essentially a first movement that is a rotation and after an oscillation. So I tried, and I would say it's true. It improved a little bit, probably not the rate of transection, but the speed of the movement. It's a little bit quicker. And I decided to do a new instrumentation. First, wireless. I was thinking about it for a while, almost from the last 10 years. Because this wire is boring for me, and I wanted to have a little instrumentation, and I love this idea to have this foot pedal and this wireless system, like a pen.
It's like a pen.
Like a pen, and so it took a very, very long time to succeed. But not only we placed this wireless system, but I tried to have the wider possibility for people, because many people has different practice, and with the new system, it's almost possible to do anything you want. If you want to have even a rotation, you can have it. If you want to have an oscillation, continuous oscillation, like you do, it's possible. If you want to have only an oscillation that is made by the movement of the pedal, you can. If you want to have a rotation first and after an oscillation, you can, and you can modify the different characteristics. You can also have 2 oscillation if you want. So I didn't even try everything. I will continue to try, but with this, because it's still a prototype, but almost ready. I know that the main movement I love now is this little rotation and after an oscillation.
Right.
And also...
so rotation is to penetrate the skin?
Yes.
And then oscillation releases deeper layer of the graft?
Yes. The fact is that I modify also the punch in the same time. And the fact that I came to this new device, this new shape tornado, change also the sharpness. Because the teeth are really external now. They are really on the 90 degree. The axis of the punch is there, the flat part is there, and the teeth is there. So in fact, the teeth are on the same, the same direction than the axis, but on the side. And it's and by reducing also the width of the branch of the T, it became really sharp, really sharp. And also, it was a complaint, especially in the beginning of many doctors. They use a lot the sharp. So it's true that with the sharp, it's really, really quick. This is not my way. I don't try to get as much graft as I can. My way is to try to balance quality and speed. It's true that if it's possible to have a good speed, it's much better, but not by increasing the rate of transaction.
Right.
And now I'm doing easy 1,000, sometimes 1,200 an hour. And because I have also my assistant that is removing in the same time, I believe it's good, you know.
It's great.
It's great. I can do 3,000 during the morning, easy, and
planting in the afternoon.
Planting in the afternoon.
Yes,
I believe it's
and grafts
good
are
enough.
not out of the body that long because the process of
Sure.
harvesting doesn't take that long. I'd like to thank you for the first device. I'm excited to have your second device available soon. I already saw a prototype and I absolutely love it. It's very light. It doesn't have a sound and it doesn't have a cord. It's virtually silent when it works. It does make grafts bigger and better, in my opinion, and I'm looking forward to start working with it. Thank you, Jean, so much for your time and for this wonderful talk about the power of invention. And when it comes from an FUE surgeon who knows the entire process, it is destined to succeed. That's my opinion.
Thank you very much. Thank you to welcome me.
You're welcome.